Bismillahirrahmanirrahim. A goal without a plan is just a wish. Today topic of my presentation is a planning model in which proceed, patch, match, map and chip model. Learning objective of my presentation is proceed model, strength and limitation of proceed model, patch model, match model, map, chip model, recent updates, and MCQs. In the end of my presentation, participants would be able to describe different components of proceed model, match model, patch model, map model, and chip model. Now we discuss one by one these all models. Proceed. Proceed is actually an acronym that stands for predisposing, reinforcing, and enabling construct in educational diagnosis and evaluation. It outlines a means for accurately diagnosing and planning a public health program for a targeted community. And what is PROCEED? PROCEED is an acronym for policy, regulatory, and organizational constructs, educational and environmental development. It facilitates the program design as a result of PROCEED process by guiding the implementation and evaluation of those PROCEED programs. There are 9 phases of proceed model, and now we discuss one by one these all phases. Phase 1, social assessment. It defines the quality of life, problems and priorities of the target population, involves member of population in a self-study of their needs, and the social indicators are abstinence, alienation, crime, discrimination, happiness, rights, self-esteem, welfare, and unemployment. In phase 2, there is an epidemiological assessment. Use data to identify and rank health goals or problems that identify in phase 1, and the data includes like disabilities, fertility rates, fitness, morbidity and mortality rates, physiological risk factors like incidence and prevalence of the diseases. In phase 3, there is behavioral and environmental assessment. It determining and prioritizing behavioral and environmental risk factor linked to phase 2 health problems. And in behavioral, there is a compliance, coping, prevention, activities, and self-care. And in the environmental factor, there is economic, services, society, access, and affordable are included. Phase 4, there is educational and ecological assessment. It identifies and classifies factors that have the potential to influence a behavior. And in predisposing factor, there is the knowledge and traits, and in reinforcing is rewarding and feedback, and in enabling factors, barriers created by societal forces. Phase 5 is administrative and policy assessment. Determine if the resources are available to develop and implement the program, establish goals and objectives, and it ends. In phase 6, there is the implementation, and for the implementation, we select models and strategies for the intervention, and the implementation begins, begins. Process evaluation. It based on goals and objective of phase 5, measurements gathered during implementation to control and ensure or improve program quality in the evaluation process. Impact evaluation. The immediate observable effects of a program leads to the intended outcomes of a program. What is the impact of all the model or all the strategies? And in outcome evaluation, we can achieve the ultimate goal or product of a program, generally measured by a morbidity or mortality, vital measures, symptoms, and sign and symptoms. These all are the phases of proceed model. Application of proceed model. Coalition building, enhancing community participation, planning health education programs, planning multiple channel intervention, implementing health risk appraisal at worksite, planning employees assistance program at worksite, influence healthy worksite culture, comprehensive school health education, improving self-care and compliance behavior. There are many strengths of proceed model. It is popular and most researched model. It exists from 4 decades. It is very comprehensive and cover all areas of planning. Initiation of the model utilize community inputs and participation. Paced evaluation is also a strong feature of this proceed model. There are few limitations of proceed model. It is too comprehensive to be applied in a reasonable time period at a setting, require heavy financial and human resource input to become functional, mixture of several theories, comparative studies lacking. The next model which is discussed is PATCH model, and it stands for Planned Approach to Community Health. Planning model developed in the mid 1980s by the CDC in partnership with state and local health department and several community groups. Capacity building is a very important part of the PATCH model. PATCH is designed to strengthen state and local health department capacities to plan, implement, and evaluate community-based health promotion activities targeted toward priority health problems. There are some key elements of PATCH model. Community member participation is the main process in the PATCH model. Data guides the development of program. Participants develop a comprehensive health promotion strategies. Evaluation emphasis feedback and program improvement. Community capacity for health promotion is increased. There are 5 phases of PATCH model. Mobilize the community, collection and organizing data, choosing priorities, develop a comprehensive intervention plan, and at the end, evaluating the patch. For example, in Baltimore, patch was implemented to improve the mental health among elderly people living in urban people housing development. Health workers were trained to identify and refer residents who may need mental health care to patch nurse. Psychiatric nurses with consultation and supervision from psychiatrists provide psychiatric evaluation and treatment in the resident's home. Investigator evaluated the patch program to determine whether it is more effective than usual care in decreasing level of depression and other psychiatric symptoms. Match model, multi-level approach to community health. Intervention activities should be aimed at a variety of objectives and individuals. When the match is needed, when behavioral and environmental risk and protective factors are known, when general priorities for action have been determined, main focus on the program development. Match. There are 5 phases of match model. Multi-level approach to community health. Match stands for, and in phase 1 there is a goal selection. And how we select a goal: select healthy status goal, select high priority target population, identify health behavior goals, and identify environmental factors goal. In phase 2 there is intervention planning. Identify the targets of intervention, select intervention objectives, identify mediators of intervention objectives, select intervention approaches. What are the target of intervention action? individuals that exert influence or control over the personal or environmental condition related to the health and behavioral goals, levels of target of the intervention action. It may be individual, interpersonal, organizational, societal, and governmental. In phase 3, there is a program development. Create program units or component, select or develop curricula and create guides, develop session plans, create or acquire instructional materials, product, and resources. And in phase 4, implementation preparation. Facilitate adoption, implementation, and maintenance. Select and train implementers. Phase 5 is the evaluation phase of match model. Conduct process evaluation, measures impact, and monitor outcome. The next model is MAP model, mobilizing for action through planning and partnership. It is a joint project of National Association of County and City Health Officials and the CDC. It is a model for improving community health system whose mission statement is communities achieving improved health and quality of life by mobilizing partnership and taking strategic action. There are different phases of MAP organized for a success: visioning phase, the assessment phase, and the assessment phase is very important phase of the MAP model. Community theme and strengths. There are four types of assessment: community themes and strength assessment, local public health system assessment, community health status assessment, and force of change assessment. And the next phase is strategic issues, goals and strategies that are made during the MAP model and the action cycle. How do you conduct a MAP process? Understand and using the guiding principle, system thinking, dialogue, shared vision by collecting a data, partnership, strategic thinking, and at the end, celebration of success. When is MAP appropriate? When a current or potential health issue surfaces either in a media or among health practitioners, when there's been an issue or crisis that everyone agrees wasn't handled well, when there's money available for health system, when there is no money available for health system, when the community is about to build a new health facilities, when there is a government push to re-examine public health or the local health system. MAP basically focus on strengthening the local health system. MAP increase the visibility of public health in the community. The MAP process create government leadership on public health issues. MAP takes a community perspective with the overall goal of creating a healthy community. And the next model is CHIP model, Community Health Improvement Process. CHIP is slightly different from other similar process in that it incorporates accountability into the planning, implementation, and evaluation of the community health improvement efforts. It's fostered. Basically, CHIP is a framework for a process for building community health, and it is developed by a Incorporate Institute of Medicine, and it has a journal guidelines like it define health broadly, develop specific quantitative measures and hold responsible groups accountable to them. It balances long and short-term goals, include all stakeholders and other potential contribute to the work in assessment, planning, and implementation. A chip should be centered in a community health coalition or similar entity. It has two chip model basically has two interacting cycle. The number one cycle is problem identification and prioritizing cycle, which include phases of community organization assessment and selection of priority areas. And the second cycle is about analysis and implementation cycle, which include seven phases that range from planning through implementation and at the end evaluation. Chip process of developing indicators has so basically chip model has a two cycle and it focus on bringing community stakeholders together in a coalition, monitoring community level health indicators, identifying specific health issues as a community priorities, emphasis ongoing nature of community improvement processes. These are the differentiating point of all these models: proceed model, match model, patch model, match model, map, and chip. In proceed model, it basically a medical perspective to a public health and its main focus on health promotion and community participation. In patch model, community health plan, it is related to community health planning model and it the main application at local level and the assessment function is the main feature of patch model. And in match model, there is a multi-level approach to community health and the main focus on program development. And in map model, the main target is the communities and the goal is to equip with structured framework for planning healthy programs. And in the chip model, it is the process for building community health. It provides the way you improve, how you improve the community health. Recent update, the proceed model as a tool in public health screening. The proceed model provides an excellent framework for health intervention program, especially in screening contexts, and could improve the understanding of the relationship between variables such as knowledge and screening. Given the complexity of behavioral change process, certain important predisposing factors could be measured in future studies and during health intervention planning. Community Health Improvement Plan. It is basically an online system of community health improvement plan. The CHIP is a 3-year community driven plan that ultimate goals and strategies that will be used by coalition, task force, organization, and citizen to address the identify health priorities in the community. Mobilizing for action through planning and partnership map resources. The purpose of this resource guide is to provide guidance on how the map process can be inclusive of people with disabilities. The goal is for health departments to have the tools and resources to actively engage with disabilities and the agencies that serve them in the map process, particularly for inclusion efforts to support community health assessment and development of community health improvement plans. If we have a healthy neighborhoods, then there is a healthy communities. Neighborhoods are where we live and communities are how we live together. If all facilities are available, then we develop a healthy communities. MCQ session. Which health planning model uses a framework to provide guidance in planning a health program and a framework for identifying strategies to address factors linked to outcome of interest? Comprehensive health education model, match model, patch model, proceed model. D, proceed model is the correct option. The educational and ecological assessment phase of proceed includes determining, predisposing, reinforcing, and enabling factor, educational strategies, genetic and environmental factor, health and policy strategies.
A.
A, predisposing, reinforcing, and enabling factor is the right answer. Matching appropriate strategies and intervention with projected changes and outcome occur during which phase of proceed model? Epidemiological assessment, administrative and policy assessment, phase 5 implementation phase, and outcome evaluation.
D.
D, outcome evaluation is the right answer. All of the following program model focus on linking the communities, local health department and the state level health department except MAT, patch model, match model, proceed, and CDC.
D. C.
C is the right answer, proceed model. The basic philosophy of MAP of community participation in planning and implementation are like other models, but it is distinguished from other models by planning phase, implementation phase, assessment phase, or evaluation phase.
C.
C, assessment phase is the right answer. MAP is targeted to communities and its goal is to equip them with a structural framework for planning healthy program. In its third phase, it conducts the 4 assessment. Which of the following is not its assessment? The community theme and strength assessment, the local public health system assessment, the force of change assessment, environmental assessment.
D.
The environmental assessment is correct answer. CHIP has 2 interacting cycle. First one is problem identification and prioritizing cycle. It includes all except identify health issues, prepare and analyze community health profiles from community health coalition, develop healthy improvement strategies.
C.
C is the right answer. MAP process is centered on community organizing and partnership development. It has 6 phases. Which one of them is distinct phase with 4 assessment? Phase 2, phase
B.
3, phase 4 or 5?
B.
B, phase 3 is correct one. Different planning models are explained. Capacity building is one of important component of which model? Patch model, match model, chip model, or map model?
D.
A, patch model is right answer. Capacity building is important component of patch model. A chip is a community health improvement process that can also be used for building a healthy community. Chip is slightly different from other similar process in that it incorporates policy, regulatory, and organizational construct in educational and environmental development, accountability into the planning, implementation, and evaluation of the community health improvement efforts it foster, health goal selection, intervention, planning, development, implementation, and evaluation. And D is the community mobilization, collect and organize data, choose health priorities, intervention, and evaluation.
B.
B is the right answer. Accountability into the planning, implementation, and evaluation of the community health improvement efforts it fosters. Key of my MCQs, and thank you.
Okay, thank you very much, Dr. Naila. Very nice presentation. Very important points have been highlighted, especially about different models of community systems and how the chip model that is effective in evaluation and implementation of these important key performance indicators that have already been highlighted in yesterday's presentation. Very well done. Today we would have a face-to-face meeting in the department, and we would discuss all these presentations in detail as well as our action plan for future. Thank you very much. Allah Hafiz. See
Good
you
afternoon,
today,
ma'am.
inshallah, in the
Thank you,
department.
ma'am.